Thank you for watching Open Line and joining in our discussion on COVID-19 with Dr. David Aronoff from Vanderbilt University Medical Center. We do have a couple more callers here I want to get to. Bob, you are live on Open Line. Go ahead.
Joining in our discussion on COVID-19 with Dr. David Aronoff from Vanderbilt University Medical Center.
Bob, are you there?
Yes. What is the risk of going to a hospital this week for a procedure, a colonoscopy and endoscopy?
Thank you for calling.
Yeah, really good question. Right now, most hospitals are taking a lot of extra precautions to protect patients and to protect the employees of the hospital and the healthcare workers. So, for example, wearing extra personal protective equipment. Here at Vanderbilt, we're required to wear masks all the time on campus, unless I'm by myself in my office, as I am right now. I don't need to be wearing one, but I have my mask handy. And we all get screened for symptoms of COVID-19 to begin our shift. And we get our temperature taken to begin our shift as well. And so I would say that right now it's still safe to go and get procedures, particularly if they're needed. The rate of COVID-19 in people who don't have any symptoms at all is still really, really low. If you have symptoms of COVID-19, I probably would not go to your appointment and call your healthcare provider, and you may need to get tested. But if you're nervous at all about it, it's a great opportunity to call the clinic and just walk them, ask them, what are you all doing to keep your patients safe? What are extra precautions I might need to take? But if there's a procedure that you need to have done, I think you should feel confident in doing it.
I'm going to go to another caller here. Michael, you are live on Open Line.
Hello?
Hi, Michael. You're live on Open Line. Go ahead.
Yes, I've noticed as I've had to go to eat or something like that, going through the drive-thrus, and even shopping, that about 40% of the people who are even wearing masks are wearing them below their chin or just on their mouth. Is there an instruction y'all can give on maybe how you should properly wear a mask so that people will know what they're doing? Because like I say, I see at least 40% of the people I see don't even have it over their nose or their mouth. They're wearing it as a chin guard. And I don't think you can get COVID on the chin. I'm not sure.
Thank you for calling. Definitely a good question there.
Michael, that question is really great because there is a lot of confusion. I was talking to somebody else today who was remarking that she saw people wearing their masks below their nose. Here's the thing with this virus. The virus replicates a lot in our nasal airways. So when we breathe, it can come out of our nose and come out of our mouth. And the best way to block that is to wear a cloth mask that blocks the water vapor that comes out when we're breathing or speaking or shouting or singing or coughing or sneezing. If we keep the mask below our nose and we're breathing through our nose, we're essentially not wearing a mask. We're not really doing our part to block the virus. I've seen people take off their mask or put it below their chin when they're away from other people, and then put it back on when they're near people, and that's good. What I'd say is really when you're taking on or putting on or taking off your mask, do it by the ear loops if it's by ear loops, or untie it behind your head, and then put it in a clean, dry place while you don't have your mask on. Make sure you clean your hands before and after adjusting your mask, and try not to touch your face a lot when you have your mask on. But the mask is a simple tool. It physically blocks the virus from getting from my face to somebody else's if I'm the one wearing the mask. It's pretty simple, but it's easy to mess up. And so your question is super important, and we try to provide a lot of signage in stores and online, and lots of information about how to do it right. But it's a little bit like a football player leaving their helmet on the bench to go out and play. If you don't have it on, it doesn't protect.
So it's important not only to wear the mask, but you need to wear it correctly.
That's right.
And what about cleaning the masks? Also, that's another thing people, as you wear it, you take it off. As you mentioned, you want to take it off and store it properly. But does it need to be washed every time you wear it?
Yeah, cloth masks generally should be cloth masks that are durable for washing. And that means you could wash them by hand with soap and water. If there is a nice thing about this virus is that it's very wimpy outside the body and it's easy to destroy the virus with soap and water or common disinfectants. So you can wash your mask with soap and water. You can put it in the laundry machine. You can dry your mask. Heat is really good at inactivating the virus. So even if you wash it by hand, if you have access to a heated dryer, that's great. But even if you don't, air drying it is fine. What I recommend is that people put on a clean new mask when they start shift at a job or they're starting their day, and they can wear that mask throughout their shift or throughout the day and then clean it that night and put a fresh mask on the next day. If they are able to, it's good to have a backup or two in case your mask gets wet or you drop it or it gets soiled in some way, and then you can quickly exchange for another mask. But I'm in the habit now of laundering my masks every day and having a fresh one that I put on at the beginning of my day.
All good advice. Thank you so much for all of your insight tonight, Dr. Aronoff. We appreciate your time and thank you for joining us.
Emily, thank you very much for having me on. I hope this was useful. It's really an honor and it's a great privilege to be able to talk directly with folks who are calling in.
We appreciate your time. Thanks again, and we'll be back with more Open Line right after this.